Alright.
Yeah, everybody. Good morning. I repeat again, we're going to start assembly. It's just a few minutes late. The purpose is actually to start on time at 9 every week. We'll be discussing a bit about the CME day from next one onwards. But for now, we'll just start first. Today's theme is about dengue. We'll be starting with Dr. Qayyum's presentation on dengue overview. We followed by Dr. Munira's session on fluid for dengue, then PITS dengue, as well as a case discussion. Each presentation is 20 minutes. I'll be timing, so the presenters will stop promptly after 20 minutes. Then Q&A too, we'll see how it fits into the timeline. Without further ado, we start with Dr. Qayyum.
Assalamualaikum and good morning. Yang online boleh dengar? Siapa nama? Amuza dengar tak Amuza?
Dengar.
Alright.
Boleh.
Dengar doktor, dengar.
Nampak skrin nampak? Okay, so
Skrin nampak doktor?
okay, thank you. So we will go with dengue overview. This is revisions. Most of us already master in dengue. Okay, we see dengue almost every day, and nowadays dengue is everywhere. Every patient come to the ED, we have to suspect dengue, but that does not mean we have to take NS1 combo to every patient. Just high index of suspicion. Okay. So the objective, we will look at the dengue pathogenesis and pathophysiology. Why? We will need to know how our enemy works and how to overcome them. Okay, this dengue pathogenesis and pathophysiology mainly occur in severe dengue. Okay, we will look at how our body reacts and what the virus does to our body. Initial approach and hemodynamic assessment, which are the most important part of the initial assessment, initial approach. Okay, and then we will look at the leaking, bleeding, or leaking, how to recognize them. Okay, so this is the two-way interactive session. Okay. Okay, so let's warm up. For those who's going for exam, okay, true, false. Okay, which of the following are most of transmission of dengue virus? Mosquito bite. True. Nombor 2. B. False. Okay. C. Siang. Total markah sekarang 1 lah. Kami salah, negative 1. Correct answer is positive. True. Blood transfusion is a true. So D. Actually, needle stick injury is also true. Can be is through the blood, but the vector is dengue. The vector is mosquito. The vector is mosquito. The transmission is through the blood. Theoretically, blood transfusion, needle stick injury can be infected. Tapi the main one is the mosquitoes. So dengue, just like any other infectious disease, can be asymptomatic, febrile illness, influenza-like illness, dengue fever, which are diagnosed, and severe dengue, which characterized by vascular hypermobility. Okay, so basically, part 1 is Shiham will explain. Okay, so when the dengue virus infects goes into our bloodstream, okay, if the patient have a severe dengue, these reactions will occur. Okay, but bear in mind, majority of dengue patients, they are self-limited. Okay, only a few percent, kalau dalam graph tu 5%, 10%, saya boleh tak ingat, 5% that will go into the severe dengue. In patients with a secondary dengue infection, will have severe dengue as a risk factor. Okay, but in a primary dengue infection also can present with severe dengue. So what happens is when the virus enters our blood through the mosquito, this virus is very smart. Dengue 1 virus, it infects the it affects our macrophage or dendritic cells. Our polis lah, orang kata apa kan? Polis, askar. Dia masuk, dia brainwash kita punya sel untuk replicate and produce more virus. Okay, so will lead to viremia. So when there is viremia, our body will respond by bagi bom peluru semua lah, cytokines, okay, inflammatory mediators. So this will cause a cytokine storm reaction. Patient will have high fever, chills, rigor, lethargy. Okay, and at the same time, okay, when we have a cytokine storm, there will be vasodilatations. So patient will have distributive shock. Okay, to number one. Number two, when the virus comes, it affects the glycocalyx. It will affect the glycocalyx. Glycocalyx will be damaged, so the endothelial membrane integrity will expose or other lubang. So there will be leakage of plasma. Okay. So there will be also third space loss. Patient can goes into dehydration shock. Okay, next, when the virus comes, it also inactivates our T and B cells, immune system. It goes into bone marrow and inactivates the immune system. That's why we will have WBC will be low. Okay, it infects the bone marrow. Platelet also will be low. Okay, and at the same time, the platelet is low. Platelet will also can leak into the space. And these platelets, that what are the platelets? The remaining platelets are actually not effective, ineffective platelet or inactivated. That's why patient can have bleeding. Sorry, yeah. Okay. Oh, nampak?
Dia tak keluar full slide show.
Oh ya.
Dah, okay.
Okay. So, cytokine storm, vascular permeability, and abdominal hemostasis. Okay, so platelets. So when patient has bleeding, the platelets will create platelet clumps. So in severe dengue patients, the platelets are not working, so they are more prone to bleeding. So faham lah? This is what happens in blood only, but when the dengue virus affects the brain, lungs, kidney, hypolipidemia, liver, then all of that multi-organ function. So these are the most important slides. So dengue divided into febrile, critical, and reabsorption or recovery phase. Okay. So in the complications of in the febrile illness, the patient will have a very sudden onset of high-grade fever. Okay, sudden onset of high-grade fever, chills, rigor, and the potential complications that patient will may have: dehydration, hyponatremia, or febrile fit. Okay, at that time, the lab will not show any changes yet. If we take the FBC at the first day, it can be normal. Okay, at that time the viremia will be high. So in the critical phase is the one that we must watch out for. It characterized by the leakage, the pathogenesis that we mentioned earlier. Okay, so in the critical phase characterized by rapid drop in the temperature. Patient kata okay dah tak ada pam dah, tapi saya tak larat lah, sakit-sakit badan semua. Okay, patients can go into shock, bleeding, and organ damage, and encephalopathy if not treated promptly. And also organ impairment. So lab changes, the platelet will be low, means that the virus already invades the bone marrow, and then the hematocrit will be high due to the leakage hemo concentrations. Okay, and the lab IgM, IgG can be positive at this time. So next is the recovery or reabsorption. In any other viral illness or in a normal mild dengue viral illness, patients will recover completely. But only in some subset of patients, they will go into the complications of critical and recovery phase lah. Patient can go into, due to the fluid reabsorption, can go into APO if we are not careful in fluid therapy. And also if patient is stable, the patient will have a normal status, normal hemodynamic status, and they will have a increased diuresis. patient in ward we say doktor saya dah kencing banyak, dah pasal okey, keluar merah dekat tengah, maksudnya patient in recovery phase. So in febrile phase, do we need to give the IV drip at all for all patients? Does dengue equate to IV drip? No. Okay. One study state that the IV drip is the one that kills the patients. Okay, if we are not careful, we will go into that one will be presented by Dr. Moon. We can give ORS also can. Okay. Okay. So when patient come, this is the basic. Oh, sorry, so this is the basic approach to emergency department patients lah. Initial triage, research and stabilize, establish diagnosis and differential management of the disease, and we have to know to manage the complications, or we have to expect the complications from our treatment lah. So in green zone patient, usually research and stabilization is not needed. But if in patients in critical zone, red zone, then we have to research and stabilize first before the history. So, clinical features of dengue from the history. Okay, what to ask? Semua dah master lah kan? Fever. Sometimes we have to ask history of fever. We got last 2 weeks patient came with jatuh motor, ada ICB. Kita ingat due to the trauma. But that ambil blood that let low. Further history, patient tak larat tu jatuh sebab tak larat. Jatuh, then patient actually have a severe dengue with bleeding. Okay, so they may present in the critical phase lah. That one patient have a history of fever, not current fever. Then ask for warning sign and comorbidities. Why? Dengue with comorbidities is actually a different group of patient. If they look stable, they may need further close monitoring, may need admissions. For example, patients dengue taking warfarin, dengue with uncontrolled DM. Okay, if unsure, just refer admit. Sebab patient need close monitoring, they can go into severe dengue. So first look for severe dengue, leaking shock and organ impairment, and first touch to know that this patient is in shock, compensated shock or decompensated shock, so not to miss our patients. So basically, dengue fever, the description of dengue fever is a dramatic breakbone fever. Okay, patient will have a severe bone pain. Doktor sakit sangat. Also last month juga patients kat green zone, main sebab doktor sakit belakang, sakit sangat. Kita pun buat x-ray semua, tengok nombor sacral x-ray tak ada apa-apa, neurologi semua inside, tapi doktor sakit sangat ni. Kita tanya balik 2-3 hari lepas, oh ada demam, ada PKP, buah hidrit, tak larat. So kita ambil RP dia, hyponatremia. So buat FBC low, WBC borderline, buat dengue positif. So medical treat in the critical phase lah, in the reabsorption phase, still he having the symptoms. Patient tu also dia ada multiple comorbid juga, AF, hypertension. Okay, so touch, we have to do the CCTVR, okay, to detect the perfusion. Okay, so in febrile phase, the patient still have fever, okay, or history of fever. Critical phase, what was the last onset of the fever? Okay, and then recovery phase, does the patients pass urine normal or having a SOB? So after we suspect dengue, we have to put a differential diagnosis lah. Not every febrile patient is a dengue. So strep pharyngitis, flush faces can be due to the fifth disease. If the patient came in with a late febrile phase presentation, vomiting, abdominal pain, can be the acute gastroenteritis, but can also be dengue lah. Okay, so patient might with AGE, you have to suspect dengue. How to suspect? Good history, good examinations. Okay, hematologic abdominal pain can cause by other things. So other differential diagnosis in the critical phase, lepto, this one we have to broaden our differentials. Okay, so this one we already know. Probable dengue. So kalau kat Kedah ni, patient mild fever, myalgia, arthralgia dah probable dengue. Okay, tapi perlukah kita ambil NS1 from good clinical history, clinical examinations. Kalau tak sure, discharge patient with repeated FBC or dengue combo at the KK also can make patients stable. So warning signs, okay, abdominal pain, semua ingat kan? Sakit saya tanya balik ya. Okay. So in the criteria for severe dengue, when there is severe plasma leakage leading to shock, fluid accumulation with respiratory distress, or severe bleeding, and severe organ involvement, liver, CNS, or heart. Okay, so ingat balik ya. Okay, abdominal pain or tenderness due to the plasma leakage, poor perfusion to the GIT system, persistent vomiting, 3 or more, bukan vomit, bukan doya saja. Maksudnya persistent vomiting 3 or more, persistent diarrhea 3 or more per day, clinical fluid accumulation, mucosal bleed, lethargy, confusion, restlessness, tender liver, increase in hematocrit with rapid increase in platelet count. So kalau saya tutup ni boleh ingat tak? Cuba repeat.
Tender liver,
Okay.
ada mucosal bleed, ada persistent vomiting more than 3, persistent diarrhea more than 3, ada increase hematocrit, increase
Okay, tak apa. Jom kita tengok apa tu mnemonic. Okay, ni mnemonic from our USM lecturer. We have mnemonic ustaz ni. We have bleeding. Apa dia? Yeah. Effusion apa dia maksudnya? Clinical accumulation. Finish? Hematocrit increase, platelet low, abdominal pain, tenderness, V vomiting, persistent diarrhea, R restlessness, lethargy, liver tenderness. Kalau saya ingat ni saja. Okey, ingat tapi tak ingat juga lagi. Okey, apa kalau kita assess patient, kita ask, kita look properly, then we will remember this basically poor perfusion to the main organ lah. Okay, so the hematocrit and platelet low due to the dengue virus attacking our bone marrow. Okay. So in our first touch tu, our physical examination, we need to assess for compensated shock or decompensated shock. Basically, we can miss compensated shock if we do not touch the patients. Okay. Compensated shock, prolonged refill time, cool extremities, with very tachycardia. Okay, so just caveat in the CRT ni, sometimes our CRT is affected by the ambient temperature and our own temperature, body temperature. Kalau patient tu having high fever, they will be CRT memang prolong. Okay, kalau patient tu duduk dekat red zone banyak hari dah, CRT pun sejuk sebab sejuk akan prolong. Tapi the one that will not change is the pulse volume, pulse. Okay, so we need to carefully assess the patient, and remember our thermometer dekat ED ni, all of them cannot be trusted. No, you have to touch the patient. Patient tu tachy 160, 170 tapi panas. Takkan kita nak bolos semua tu. Tayar bagi PCM ni. Bagi PCM dan reassess. Sometimes patient tu akan okay. Okay, walaupun temperature dia by our thermometer 36. Tadinya saya tak cakap bohong ya. Okay, kita akan repeat. Lepas tu kita akan bagi PCM. So early sign of shock, postural hypotension, increase in the diastolic blood pressure and narrowing of the pulse pressure, 20, less than 20 or more. So bleeding, leaking or blinking, this one will be touched by Dr. Yao later. Stable patient, hematocrit normal. Kalau leaking, high hematocrit. Kalau dia bleeding, very good. Tapi clinical, tapi kita jangan sebut lab saja, kena sebut clinical assessment unstable. So severe bleeding, hematocrit, severe bleeding, severe plasma leakage, hemodynamically suggestive, hematocrit will be normal. Ingat clinical and lab, jangan mempandukan hematocrit sahaja. Okay, the normal value. Alright. So lab investigation point of care. Remember, if all of the NS1 combo negative does not mean the patient does not have dengue. Probable dengue also still can. Still high in the suspicion, kita letak ya probable dengue, tak apa. Okay, kalau patient stable, you go back to KK and reassess. Okay, kalau tak stable, ini comorbid, ini probable dengue with comorbid lah. Okay, so dengue management yang apa in shock, compensated shock, severe shock semua tu kena admit. Okay, and apa yang can be discharged, good oral intake, passing urine normal. Okay, and also hemodynamically stable, can be discharged with reassessment. Okay, any other questions? Oh,
2 minutes.
no minutes.
The purpose is actually for everyone to practice to speak within time. That is actually a skill lah. For us pun Dr. Koyum dah breathless tak? Any questions?
Kalau fever tu any degree of fever, kalau dia masuk critical phase, sometimes ada di temperature kalau temperature 7.9 7.8 is considered.
Actually yang still can in the critical phase. Actually yang tu dikata rapid drop in the temperature. Sebelum ni 40 ni ke 7.5. Still pada kita fever, tapi dia rapid drop. So and followed by other clinical assessment. Bear in mind, some patients may not follow this febrile recovery reabsorption phase when they presented to us. Okay, they may come in the febrile phase, may come in the recovery or reabsorption phase. Kita tu ingat fluid overload, secondary to fluid overload for investigation. Kan, tengok lah, dia ada fever sebelum ni. Sebelum tu tapi GP bagi 2 pint. Okay, lepas tu discharge. Lepas tu bila doktor cakap demam dah habis dah, tak makan dah Panadol, tapi sesak nafas. Kita pun ECG ada QA sikit-sikit lah SEF lah. Tapi further history can be dengue in the reabsorption phase. Okay. Lagi question?
Untuk for severe dengue, for those yang ada transplantis, the role of acetaminophen in that thing.
Yang tu saya subcon ke kamu. Tapi takut yang tu ada kot. Yang tu tak apa, yang kita consult IDN intensive. Okay, dalam guideline tu dia ada mention, tapi saya tak ingat dia punya apa recommendation dia grade berapa. Saya rasa tak apa. Kalau severe, kalau dah tu ICU punya ni lah. Okay, ingat boleh tak tu severe dengue warning sign behavioral apa? D bleeding, E okay. H hematocrit high, tak ada low. V vomiting. R restlessness. L satu lagi liver tenderness. Apa ni memang saya ingat yang tu je. Tapi kalau kita check daripada top to head to toe pun akan apa? Teringat jugalah. Okey, habis dah. Okey, habis. Okey. Thank you.
Dr. Koyum. Next Dr. Mengira kalau ada questions, you can just keep the wording nanti towards the end tu. Apa yang ada sampai kita can clarify towards the end. Kita habiskan untuk that first.
Mana ni ah? Saya.
Tak pasang kamera tak. Tak apa, Dr. Mengira set up, we'll give some time for that. Sementara tu, going forward, we will be trying this format untuk CRT for the time being. One thing adalah the aim is to finish before 11, hopefully by 10:30 everything is done. This week is a bit packed sebab we packed 4 topics. But then hopefully kita boleh maintain lah. Kalau 30 minutes. So the plan is actually to give targeted topics. So maksudnya topics tu akan jadi di-narrow down macam tu. So macam Dr. mempunyai topik will be just quick sahaja. Just that. So that you boleh fokus lagi. The expectation would be that before kami you'll be reading a bit lah. We bukan datang zero lah. So it's a refresher dan juga untuk you clarify what you need to know. Thank you. Since it's ready, we are going to sekejap. Saya nak post recording sekejap. Kita nak buka dia punya.
Ini mic baru
Mic sebelum ni dah patah dah pun.
Seriously? Adik-adik tak ramai. Adik-adik ramai online ni. Oh, adik-adik ramai online. Husband je nak present kan? Lama kat present.